Hello and welcome back to Yashoda Hospitals online segment, the Health Talk session. India is home to the world's second largest adult diabetic population, and every sixth diabetic patient in this world is an Indian. So, what is diabetes? What are risk factors? And what are the newer treatment modalities? Let's discuss about diabetes in our today's episode. I'm Dr. Lakshmi, and joining us today, we have with us Dr. G. Sashidhar Reddy, consultant physician from Yashoda Hospitals, Malakpet. Welcome, doctor.
Good afternoon. I am Dr. Sashidhar Reddy, consultant physician, Yashoda Malakpet.
So, doctor, according to a recent survey, every sixth diabetic patient in this world is an Indian. Why do you think diabetes is so prevalent in our country?
The prevalence of diabetes in India is increasing day by day because of one is the increasing age of elderly people in India, and the second one is increased urbanization. Most of the population is moving from villages to cities, and even the excessive work shift change also, and many people are working nowadays during the night times. And we are a becoming world diabetes capital. We are second in the world after China. According to 2000 census, it was 59 million people were affected with diabetes, and it is expected to be 151 million by 2045.
So, do you think diabetes is more of a lifestyle disease? What are the risk factors for this condition?
So we can't say it's only a lifestyle disease, but nowadays the cases are increasing, especially even in the younger people, because of it is most of the lifestyle changes. Diabetes is a more of previously we used to say if there is a family history of diabetes, or if there is any family history of other comorbidities, there is an increased risk of diabetes. But nowadays, because of excessive junk food intake, lack of exercise, lack of proper sleep, and excessive usage of tobacco, alcohol, and these are also the causative factors to increase the number of cases of diabetes.
So, doctor, why do you think diabetes is also called as silent killer disease?
Yeah, diabetes is a silent killer because unless most of the patients nowadays what we are seeing, they present directly with the sugars of 500, 600, they will directly land in the ICU. So if you don't have a frequential health checkup, and if you don't have a proper lifestyle, by the time the patient present to the hospital with high sugars, they might be having diabetic retinopathy, or sometimes they might be having visual loss. Few people straight away present with young patients nowadays are coming with heart attacks. Incidentally, we are seeing that their sugars are 400, 500. So that is the reason we say diabetes is a silent killer. It doesn't affect only it's not about only the sugar part, it affects every organ in the body. If diabetic patient can have skin infection, diabetic patient can have renal problems, diabetic patient can have neurological problems, they can have heart problems, they can have any infection. Any infection, for example, patient is having some sort of fever, and fever uncontrolled. Incidentally, if you have a diabetes, in those people, the infection will not come down that easily because of the diabetes uncontrolled. Our immunity will be going down. They might become immunocompromised because of diabetes. That is the reason diabetes is silent.
So, doctor, what do you mean by pre-diabetic condition? I'm sure most of us have heard this term more commonly, especially when one goes through the blood reports.
Yeah. Pre-diabetic is a condition where the patient might be having inherently diabetes, or they are prone to the diabetes in next 3 to 5 years, and they are not diagnosed. So according to the American Diabetes Association, pre-diabetes is described as any patient with a fasting blood glucose between 100 to 125, or any patient whose HbA1c is between 5.7 to 6.4. And there is another test which we call oral glucose tolerance test, where we give a 75 grams of glucose to a patient, and we test the glucose levels after 1 hour and 2nd hour. And for pre-diabetes, the criteria for a patient with oral glucose tolerance test to say that they are a pre-diabetic and they have a risk of diabetes is their blood sugar at the end of 2nd hour should be between 144 to 199.
So you mean to say if one is diagnosed with a pre-diabetic condition, so you think diabetes can be prevented if we change certain lifestyle modifications?
Yeah, definitely. Any patient whom we do frequently regular yearly checkup, or if they are found to have a pre-diabetic and they are young people and there is no family history of diabetes and they don't have any addictions, or there is no smoking, alcohol, even if they have few addictions, we can tell them the lifestyle modification. If they are a smoker, quit smoking. If they have an alcohol habit, avoid alcohol. If there is a family history also, they can push. I don't say they can completely avoid diabetes, but at least they can push a few years if there is a strong family history. And if there are few people, even though mother, father, brothers are affected, everybody in the family might not affect. Ultimately, it's the lifestyle changes. If they follow regularly exercise daily, at least 30 minutes to 45 minutes a day, 5 days a week, if they control their dietary habits, if they have addictions, if they stop their addictions, definitely pre-diabetes can be stopped and they can become completely normal and prevent themselves from diabetes.
So, doctor, if one is diagnosed with diabetes, what are the treatment options available? Because most of us think that insulin is the only option and one has to end with insulin at some point or the other. Is it true?
No, actually, everybody who's on diabetic need not be on insulin. But previously, what we used to say, what the studies used to say, they used to try oral anti-diabetic agents. After trying second drug, third drug, if the sugars are not controlled, then we used to add insulin. But nowadays, the studies are being changed, because if the patient is willing to start diabetic treatment, we will suggest them insulin, because if we start early insulin, ultimately we will protect the beta cell mass, which is very important for the insulin production in the body. And the patients are starting early on insulin, their beta cell mass is prevented. Then they can slowly control the diabetes over a period of time. And even with insulin, the control of diabetes is very strictly controlled. So it was a previous notion that where once you complete your oral diabetic, then only start insulin. If some patient is willing, we can straight away start from insulin on with the day one.
So, doctor, it's time to bust few myths. Taking the first one, no one in my family has diabetes, so I won't get it. It's a myth or a fact?
No, it's not that. As we discussed earlier, any patient who doesn't have a family history of diabetes, definitely there is a decreased risk that they will have diabetes. Ultimately, diabetes is a lifestyle disease. If there is no one in the family affected with diabetes, and if I say I will take more carbohydrate, and the patient says he has alcohol, smoking, he doesn't have any good lifestyle, and if his BMI is very high, then definitely they are prone for a diabetes. They might be the first person in the family to have diabetes, and subsequently the rest of the family in the next generation might affect. So it's not that somebody in the family doesn't have diabetes, nobody will get. If the lifestyle is not good, anybody in the family can get.
So, taking the next one, diabetic patients cannot eat sugar at all.
It's not that cannot take sugar at all. Better to avoid sugar and any compounds or food material containing glucose. Instead of sugar, if somebody wants to take, and if they want to add a sweetener, we suggest jaggery is the alternative. Because any diabetic patient, once they take any glucose containing products, their sugars will shoot up immediately. So the glycemic index, what we say for any food, especially it is very high in sugar. So that is the reason we tend to ask the people to avoid glucose containing products or any sweets which are made with sugar. Alternately, if somebody doesn't want to avoid completely, can try with a small amount of jaggery.
Moving to the next one, diabetes affects only obese or overweight people, and if one is thin or underweight, they need not worry.
It's not like that. Any patient, ultimately, lean people can also have diabetes. It's not only about the weight, it's about ultimately there. For example, patient who is very lean, but still he is very much sedentary, and he has altered food habits, and he doesn't take timely diet, or if he has any addiction, smoking, alcohol, definitely they are also prone for diabetes. So it's ultimately, it's our own lifestyle which will decide whether we will have diabetes or not. It's not about only obesity or weight.
People on insulin have more severe diabetes than people on oral medication. What do you have to say about this?
No, it's not that like that. Any person who is on insulin doesn't have much diabetes. So most of the times what we do in a routine practice is we'll be starting any patient on 1 or 2 drugs. If we feel that he's resistant to that, we'll be starting them on insulin. So for example, few patients might be only on insulin. They might not be having any oral anti-diabetic drug. So that doesn't mean that patient with insulin is having very high sugar levels or is a very complicated diabetic patient. Even patients who are on oral antiglycemic agents were also might be having very high sugars.
Is diabetes a reversible condition?
No, it's not that reversible. Once there is a complication set in. For example, if the patient is having diabetes, it is not a single organ disease. It can affect any organ in the body. For example, diabetic nephropathy, diabetic neuropathy, or for example, patient with diabetes uncontrolled, they can have a cardiac disease, they can have a stroke, they can have a neuropathy, they can have recurrent infections. Female patients especially can have fungal infections. So it's not that diabetic patients once they have diabetic, they are lifetime diabetic, but with in earlier stages when the sugars are not that high, most of the patients with their lifestyle modification, dietary habits, we can control the sugars. Though we can't say that it is 100% reversible, most of the patients in early diabetes, early diagnosis, with the lifestyle changes, it can be controlled.
So doctor, personally, what is your health mantra of fitness for a healthy life?
It's not about my health mantra. Any person's health mantra is one thing is timely diet. For example, if you are taking your breakfast at 8 o'clock or 8:30, kindly maintain the diet at 8:30 or 10-15 minutes or maximum half an hour. You should not be taking breakfast at one day at 8:30, one day at 7 o'clock, and one day at 11 o'clock. So proper dietary timings, breakfast, lunch, dinner, and regular exercise. Avoid alcohol, avoid smoking, and at least half an hour to 45 minutes walking or some exercise, brisk exercises, 5 days a week is enough.
So doctor, before ending this episode, what message you would like to give to our audience out there?
So my message is, as day by day the increase in diabetes or number of cases in diabetes are increasing, especially it's not about the elder people, it's about the younger people whose day-to-day work lifestyle has become sedentary job. Most of them are doing office work, so they should have a regular checkup. Regular checkup is annual health checkup along with the diabetes screening or checkup should be there, and they should be doing a regular exercise, whatever they want. If they are habituated to play some game, they can play that game. If they are habituated, they don't have any play, they don't have any experience in any games, they can do simple walking, or they can go to some gym or do some exercise, regular exercise with timely diet and regular frequential health checkups annually for any patient below 40 years. Patient is above 40 years and 45 years, if required, twice in a year. And if they already have some complications like diabetes, hypertension, any heart issues, they should be under regular follow-up according to their physician or cardiologist, whomever they say. Few people it might be monthly once, few people it might be twice monthly, few people it might be once in 3 months. So people who are already diagnosed should be have according to their doctor's advice. People who don't have any comorbidities according to their age and previous health profile, what we say, previous investigations, or according to their previous health checkup, when they visit a physician, they'll advise you require a checkup yearly or you require a checkup half yearly. According to that, they are to follow.
So thank you, doctor. It was wonderful having you here. So this brings us to the end of this episode. Hope this episode was informative on diabetes, and don't forget to join us for the next week as well. Thank you and take care.